Hello, my name is Dr. Amy Naparick. I am the founder and CEO of Pivot Integrative Consulting. As an integrative pharmacy specialist, I empower my clients to discover root causes for chronic conditions and to improve their gut health using functional medicine, integrative pharmacy, and nutrition recommendations. I believe in food as medicine to heal the gut and provide better overall health and wellness. Welcome to Medication Class, a Pivot Snippet. Today I will provide a glimpse into my presentation on diuretics, with a focus on the thiazide class. Here is the necessary legal disclaimer. Dietary supplements are not evaluated by the FDA and are not intended to diagnose, treat, cure, or prevent any disease. Always consult with your own healthcare provider before changing any of your medications, starting a weight loss plan, or taking any dietary supplements. This presentation and the other information on my website are for information and educational purposes and should be independently verified and assessed before making any personal healthcare decisions. So let's talk about those water pills. Specifically, we will focus on the thiazide diuretics and the micronutrients they can deplete. Diuretics work in the kidneys, which are located in the small of the back just below the rib cage. Kidneys are essential organs for the filtration of your blood. They work to decrease blood pressure by removing fluid from the system. If you think about the pipes in a house, less water equals less pressure, right? Same goes for your body. These medications work by making you pee out a lot of fluid, which brings the blood pressure down. Because these medications will increase your trips to the restroom, it is recommended to take them first thing in the morning so they don't keep you up all night. This diagram is a closer look at a nephron, the filtration center of your kidneys. The purpose of the nephron is to filter out waste products and excess water from the body, as well as regulate the electrolyte balance in the bloodstream. The waste products form urine, which collects in the bladder. Different diuretics work in various places in the nephron to reduce blood pressure by reducing the fluid volume in the bloodstream. Some electrolytes can also be depleted with this fluid loss. The thiazide diuretics work here in the distal tubule. And here are the thiazide diuretics: chlorthalidone, hydrochlorothiazide, also known as HCTZ, chlorothiazide, indapamide, and metolazone. Thiazide diuretics can deplete coenzyme Q10, magnesium, potassium, sodium, and zinc. Sodium is usually in abundance in our food system, so it typically does not need to be supplemented. But let's look at the others. First, let's discuss coenzyme Q10. Coenzyme Q10 acts as an antioxidant and is critical for muscle health, and the heart is one of our most important muscles in our body. CoQ10 is needed to create energy in all of our body's cells. It can lower blood pressure, reduces platelet stickiness, which discourages clots and strokes, and provides immune and cognitive support. A CoQ10 deficiency can lead to physical and mental fatigue, difficulty concentrating, memory lapses, mild to moderate depression, and irritability. Chronic pain is also common with a CoQ10 deficiency, with frequent headaches or migraines, muscle and joint pain, and an increased risk for developing fibromyalgia. Deficiency leads to a weakened immune system, which makes people more susceptible to cold and flu viruses and chronic dental infections. The increased inflammation that can come from a CoQ10 deficiency can lead to high blood pressure, high cholesterol, and heart failure. There are some foods available that contain CoQ10, but usually dietary sources are not enough to replenish a CoQ10 deficiency. They only provide up to 30% of the recommended amount. The highest amounts appear in meats like organ meats, or beef, pork, and chicken. Much smaller amounts, less than 1 milligram per serving, can be found in non-meat sources like soybeans, parsley, broccoli, sorrel, and sweet potatoes. So, a supplement may be recommended for people eating vegetarian or vegan diets. Let's move on to magnesium. Magnesium is such an important micronutrient. It's important for energy production, converting food to energy. Magnesium helps with muscle contractions and relaxation. Magnesium regulates neurotransmitters that send messages throughout the brain and the body. It also helps to form our genetic material, our DNA and RNA. It regulates calcium to support bone structure. And a magnesium deficiency may appear as fatigue, weakness, and loss of appetite, as well as nausea and vomiting. Someone with magnesium deficiency may also experience muscle spasms or stiffness. Low magnesium levels may lead to an increase in blood pressure or blood glucose levels, brittle bones, and osteoporosis, and worsening migraine symptoms. Nuts and seeds like almonds, cashews, flaxseed, and pumpkin seeds are good sources of magnesium. Legumes like black beans, edamame, peanuts, and lima beans also contain magnesium. Quinoa, spinach, and dark chocolate can round out our magnesium foods. In fact, if you find yourself craving chocolate, you may be low in magnesium. Okay, let's talk about potassium. Potassium, along with sodium, is important for maintaining proper fluid balance in the body. It is also important for muscle contractions, regulating digestion, transmitting nerve signals, and maintaining a proper pulse rate. Signs of potassium deficiency include weakness and fatigue, muscle cramps, digestive issues, abnormal heartbeat, tingling, and numbness. Some foods high in potassium include dried fruits like apricots, prunes, and raisins, lentils, acorn squash, kidney beans, bananas, and fortified orange juice. And finally, let's talk about zinc. Zinc is great for our immune system by helping to produce antibodies. Zinc also helps our body with metabolism, wound healing, and our sense of taste and smell. Zinc also promotes cardiovascular health, so a depletion of zinc by diuretics can potentially raise blood pressure. Low zinc levels may lead to an increase in head colds and other respiratory infections, delayed wound healing, blurred vision, appetite changes, and unexplained weight loss, as well as mood changes such as irritability and depression. Low zinc can also manifest as hair loss, although too much zinc can be just as bad for our hair. A person with a zinc deficiency may also have an altered sense of smell and taste, and brain fog. Some foods that are high in zinc include oysters, chicken, grass-fed dairy, cashews and almonds, spinach, asparagus, pumpkin seeds, salmon, and dark chocolate. Some other heart-healthy functional foods contain omega-3 fatty acids. So remember the acronym SMASH: salmon, mackerel, anchovies, sardines, and herring. Vitamin D, vitamin K, folate, nitrate-containing foods like cabbage, beets, and pomegranate. They're great for the heart. And then seasonings like garlic, ginger, and turmeric. So here's a quick list of references for this presentation. And we just have one question left. Are you ready to pivot to functional health and wellness? Check out my website at www.dramynaprick.com for more presentations on this and other topics. Feel free to contact me at info@dramynaprick.com if you have any questions or to schedule a free 10-minute connection call. Thank you for listening today and allowing me to be part of your health and wellness journey.